Hope Channel, changing lives.
Hello, lovely viewers. Good evening and welcome to another episode of the Consulting Room. We're so happy you've joined us tonight. We come to you live from studios of Hope Channel Ghana every Monday from 8 to 9 p.m. I'm Dr. Nai, you can call On the Consulting Room, we bring you all the latest updates on health. And tonight, we're doing just that. We're talking all about ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. It's a long name. And our job tonight is to make it very simple for you to understand. So please stick with us. And to help me with this task, I have three wonderful guests. So I have Osajifo Nana Ifa Ampong Clement, who is a clinical speech and language pathologist at the Allied Therapist Consult in Kumasi. He's joined us on the Consulting Room before. Osajifo, you're welcome. Thank you for joining us again. Also, we have Dr. Gloria Ampong Sankodia, who is no stranger to us, who is a pediatrician and with the Healthy Kids Foundation. And then we have Yesuto Bewonyo Amedofu, who is an interventions consultant and the founder and head of interventions, training and outreach at ADEN. ADEN stands for Autism and Intellectual Development Differences Interventions Network. You're all very welcome to today's show.
Thank you.
Right, so we'll go for a quick commercial break, and when we get back, we'll get right into the conversation. Please do well to send in your questions and comments. We'd love to hear from you. Please stay tuned.
Are you a Ghanaian or resident of Ghana? Are you 30 years and below? Are you a startup, micro or small business owner wanting to scale up your business? Then apply for the Pitch 2024. Join the ranks of burgeoning startups from all across Ghana. Follow your dreams. Be bold and pitch to win a stake in the 100,000 Ghana cedis needed to unlock your startup's potential. Apply now with 100 Ghana cedis at www.thepitchghana.com.
The page is powered by Hope Channel Ghana in partnership with Seed Spring Network and sponsored by Heritage Cooperative Fund, National Entrepreneurship and Innovation Program, and our donors.
Welcome back to the Consulting Room. As I said before, we're talking all about ADHD today. Please stick with us, and I'm sure by the end of the show, you know all about ADHD. So to my guests, you're all welcome again. I'll start with Yesuto. Yesuto, can you hear me?
Yes, I can.
Okay, so can you tell us what ADHD is?
Okay, so ADHD is what we call a neurodevelopmental disorder. And basically, it is defined by impairments in attention. You have hyperactivity and then impulsivity. And so basically, when we're talking about deficiencies in attention or deficits in attention, they're talking about the person not being able to stay on task, and pay attention or consider certain details as they engage in various activities. And these occur in such a way that it affects their daily life. It affects functioning, as we would put it. So that's ADHD in a nutshell.
Okay. Right. And how common is it in Ghana?
Oh, okay. There are some studies that have talked about the range of 7 to 10%. And these are various studies in, very small populations. So we don't have like an overall statistics of the prevalence, but we have all these little studies that have been done in schools and in communities. There are a few of them, and that's what the range is looking like.
Okay. So Dr. Hampon-Sakode, I heard Yesuto mention hyperactivity. Does it mean anyone with hyperactivity or anyone we see who is hyperactive has ADHD?
Thank you, Na, and good evening to your viewers. No, who is hyperactive, who qualifies to be called a child with ADHD? No. In fact, for the diagnosis to even be made, the hyperactivity has to occur in more than one place. So it should occur in 2 or more places. So if you have a child who is hyperactive at home, but is calm at school, and then every other place, you cannot say that child is hyperactive. And you know that children generally, as when they are very young, 2, 3 years, usually they are all over the place. And it may just be a normal development. So you expect them to just sit for a few minutes and then get up and run around. And so there's a criteria that is used to make a diagnosis. So it's not just anybody who is hyperactive. It may just be the normal developmental stage of that child. And it should occur in more than one place. Among other things, yes.
But is it a condition you're born with, or is it something you develop along the line as you get older?
Criteria is that the child should have started having the symptoms before age 12. So before age 12, the symptoms should have been seen. And when it comes to the cause of ADHD, there's still a lot of research going on. What can be said for now is that there's a strong genetic link. So if somebody in the family has ADHD, or the parents, one of the parents or both of the parents had ADHD or still has symptoms of the ADHD, there's a high risk that the child would also have ADHD. It's not absolute, but the risk is increased. If there's a sibling in the family who has ADHD, the risk is increased in another sibling. So because of that strong genetic link, you cannot really say that the person is born with it, but it definitely has to be showing for us to know that it is ADHD, and it should not be as a result of another psychiatric condition. So something like schizophrenia. So if you have a child or an adolescent with another mental illness or mental health condition, and then the person is hyperactive or is having difficulty paying attention, you cannot say as a matter of fact that it is ADHD. You understand? So there should be some criteria met.
Thank you. Osajifo, so are there different types of ADHD, or maybe different levels of the ADHD?
Thank you very much. We have so many types here. We have 3 main hallmarks of the types of ADHD that when you take it to the school, to the family, that the parents or the either third person can even count with that. Yes. So the first one is come with the predominant inattentive presentations. And second one comes with the predominant inattentive and predominant hyperactive behavior. And the third one comes with the impulsification. Okay, so, but we have a very 6 types. I think that one will explain the whole thing into detail for everybody to understand. So the first one that we talk about was the classic ADHD. That one has the first signs of the predominant deficit that I've just mentioned earlier. So that one has to do with the hyperactiveness, the restlessness, and the impulsivity. And the second type is that is the inattentive, that the child is not paying much attention to the situation or the things around that child, or having a shorter attention when it comes to social interaction or one-on-one interaction with the child. Then we have the third one, which is the over-focused ADHD. That one too is very complex. That the child or adult, when we talk about the ADHD, it's not only about the case alone. So we have a child and we have the kid, like let's say, pediatric ADHD that transites to an adult ADHD. Sometimes the symptoms starts from the earlier stages that we don't pay much attention to. It transites to the adulthood stage. When it's transiting to the adulthood stage, one thing that changed from that is the hyperactiveness. The child, you won't see the child moving back and forth or here and there, but the child will try to calm himself down, not to be able to move up and down, but other function might still remain instant with the child, especially when it comes to the cognitive aspect, organization aspect, and others. We see the child having a lot of issues with that. So if you are specialized in this field, I know Dr. Gloria and Yesuto will understand. The moment you walk on the street and see people, sometimes you can easily, which we call the easy judge. You can easily say that, no, this person, the actions and the kind of the demeanor the person is putting on, the person might be on so-called maybe ADHD or the autism spectrum disorder. Yes. And I like the type 3, which is more of the upper-course ADHD. That's the cognitive inflexibility, trouble shifting attention. We have a lot of the people in the system, like when they start working on something, it's only one thing, that same thing that is supposed to work on. No amount of advice can change what they are up to. Meanwhile, 90% of the people watching her or him outside could see like, okay, when we add 1, 2, 3 things to what he or he is doing, it will really going to benefit the people. But these people have issue with shifting of that and like, okay, this is what I want to do. And it's the same thing that I have to focus. No way I'm going to look maybe left or right. So we have to get to understand this. People also have to be assessed as well, as I said. The moment you have people who have this issue, it's not like maybe they are being difficult or maybe they are mentally unstable. There are a lot of issues in the system that when it comes to ADHD and autism. But because of our system here, I was much surprised that we had issues in Ghana and we don't have a data work that. I'm working work with Dr. Gloria and some of us so that we can get a very statistical base for Ghana here when it comes to the edge in their home. Okay, quickly, let me move to the type of which is the temporal lobe ADHD. They have a short fuse, misinterpret. We have a lot of people in the system that the moment you raise an issue about maybe say the governance or if not the governance, and you see them, it's either they are talking too much or whatever they are saying is not relating to what we are even expecting them to say. So the moment you see a colleague or a partner or maybe a friend great issue, and they have issue like being in the same context with you, then it might be like, then that's another type of ADHD that we are not paying attention to, because ADHD is very young in our system. We are used to the malaria and the headache and other conditions. But when it comes to the ADHD and autism, I think there are less advocates on that. So we have to work more, and there are people really going on in this situation that they really need to be assessed. When you go out and you pay critical attention, you will see that there are lots of people having issues when it comes to this autism. And we have the limbic, the chronic sadness, and others. One thing that I want to go back, I want to allow people on is, we have people when we call it psychosis. These people also show some, let me say, there are some hallmark of some activities that usually when you have ADHD, you might have it. But there are some people that have the issue, but they are not on the ADHD spectrum. One of the factors is ADHD, a psychosis. These people can feel the social outgoing, can have different, maybe the sameness, positional immunity, or worrying about social exposure and others. It doesn't mean people who are having this are on the ADHD, but people who are on the ADHD, these signs are very hallmark to them, because they easily possess these kind of skills as well, and have the temper of ourselves, short focus, misinterpretation.
Sajif, are you there? I think we've lost him a bit. So I'll come to Yesuto. Does it affect a particular gender more, or it affects both genders equally?
Both the genders equally. Now, so what it is more is that so you want to think more about the diagnosis. Many of these neurodevelopmental differences, when it comes to gender, although we are seeing more males, it is not, we will not necessarily say it's because it's affecting more males. Think about male behaviors, and sometimes these are the things that would get some of these males picked up more easily, especially for the kind that is marked with more hyperactivity and impulsivity. You will see that more in the males. Okay, so even though right now it's around from about 2 to 1 to about 10 to 1. So like I said, it's really dependent on how diagnosis is being done. We don't have clear statistics as to the ratio, but we're saying that men or boys or males are commonly diagnosed. It doesn't necessarily mean it occurs more among them, but they are more commonly diagnosed than girls.
Okay.
I don't know if Dr. Gloria has any other thing to say about it, but that's...
Yeah, so let me just add a little bit to what Yesuto said. So, yes, so in the books, the males tend to be seen more with ADHD compared to the females. And, you know, Clement started by talking about the various types. So the ADHD, we talked about impulsivity, we talked about hyperactivity, we talked about inattentiveness. Okay, so we have those who are predominantly inattentive. So one category, find these people not paying so much attention, having difficulty focusing on what is being taught in class or what they are doing. They may not appear hyperactive. So they will sit still in class. If you are a teacher, those children hardly give you problems. So they are sitting quietly in class, they are staring at you or at the board, but they are really not paying attention. So we have that group, and that is commonly seen in females.
Okay.
Then we have the hyperactive, impulsive type, predominantly hyperactive and impulsive type. Those children usually would not sit still. So if they are in the classroom, they get up from their seats, they are the ones always talking, making noise, saying one child, moving from one end of the class to the other. And that type usually happens in males. Okay. So that is, you are likely, if you're a class teacher, you are likely to pick that person up. Okay, so we have the predominantly inattentive, and then we also have the predominantly hyperactive type. They may actually be listening to what is being taught. It's just that they are not sitting still. So those kids, when you ask them what was taught, they may be rattled. They will tell you exactly what the teacher taught, but they were not sitting still. Their problem is not so much with the attention, it's just the hyperactivity. And then we also have the third type, where it's a combination of the hyperactivity and then the inattentiveness. So they are not sitting still and they are not paying attention. So because the males have the predominantly hyperactive type and they are all over the place, you are likely to pick them up and then bring them to the clinic for help, because they are the stubborn ones. They are the ones always causing problems. The inattentive type, they are sitting quietly, but they are just not getting anything. But you may not pick them up. So yes, in the books, males are affected more than females. So that is what it is. It's about 4, like you said, it ranges 2 to
Dr. Amponsako, are you there? Okay, I think there's been a break. Yes, Tutor, can you hear me? Hi, yes, Tutor, can you hear me?
Yes, I can hear you.
Okay, so who goes about the diagnosis of a child? So you've seen a child who you think is inattentive, who is hyperactive, you bring them to the clinic. How does the diagnosis go?
Okay, so there are different people, neurodevelopmental pediatricians,
Okay.
Child psychologists. Sometimes you also have psychiatrists. All these people are capable, depending on their extent of knowledge, are capable of giving a diagnosis.
Okay.
Yes. And so usually we would take a history, because for us to see this as ADHD, it must have occurred for at least 6 months. For at least 6 months, right? And then in taking the history, we would also be looking at the fact, as Dr. Amponsa said, it must occur in more than one setting. And so most of these things are going to be observations and behavioral investigations. There is no blood test that you are going to do that would tell us that you have ADHD.
Okay.
Right. There are a number of diagnostic tools, that behavioral diagnostic tools that will be used. Checklist, again, depending on the person's area of expertise, you know. So those are the ways. And Another thing, again, in taking the history, sometimes we also look at family history. We talked about the fact that there are some genetic links to this. And so in a nutshell, I would say those are the things. And we are not looking at symptoms that have been brought about, like we said, due to the presence of any other disability or disorder. So even though it can occur, it can co-occur with other disorders.
Okay. But can ADHD be attributed to increase in screen time for children?
We are not necessarily saying that it will, so it doesn't cause, but it can increase what we call the phenotype or the expression of it. If somebody is already at risk, that can happen. And there are so many risk factors, so many risk factors, including being born before 37 weeks. So for me, I'm always saying that we have a lot more children who are being born before 37 weeks and is still considered almost full term. But there are all these brain connections that occur in those last 3 weeks of pregnancy that doesn't get to happen, and that must happen outside of the womb. So like you're already born, and so if you already have this insult to the brain and you're adding on screen time, then you're going to be changing certain ways that the brain is going to be functioning, right? And so those early years are very crucial, and a lot can happen in that time. And so while we are not saying that it directly links to it, it does have some influence, especially if they're already pre.
But is ADHD preventable?
The expression of, you can reduce the expression of it. So especially, again, thinking about the fact that it's genetic and it's not even linked to a specific gene, right? It's such a polygenic condition. So I won't necessarily say that it is preventable, but based on the kind of stuff you give your child, you can't be reducing how pronounced that ADHD will be in that child.
Right. Thank you. Dr. Amponsa, are you back?
But I hope it. Can you hear me?
Yes, I can hear you.
Yes, I can hear you.
Hi, Dr. Amponsa. So what's the impact of ADHD on the individual who has it?
Their life. So if you have a child in school who is not attentive, so doesn't really get what is being taught, then the grades of that child is not going to be very good. And then if you also have a child who is hyperactive, doesn't sit still, moving around, serving the whole class, that is also going to cause some social issues. Nobody really wants to be around a troublemaker. That child is likely not to get good people to associate with as friends. Okay, so apart from the fact that the academics will suffer, their social life also suffers. They may not get people to be their friends include, okay? And even by their teachers usually want to be with people, good, well-behaved children, children who are smart or intelligent, And so that child may be tagged as not being smart or being a troublemaker. And that even also may affect the self-esteem of that child. And then even at home, so in school, that child can be affected. At home, this is a child who would have difficulty completing any task you give him or her to do. So if he's supposed to fold his clothes, he's supposed to organize some bowls or utensils in the house, that child may start and not complete it. They also tend to lose a lot of things. So this is somebody who may come back from school without his school bag. There was one child who actually went home without his school uniform, so the shirt was off. And so it really impairs their function, how they live generally, and it's difficult for them. Completing tasks will be a problem. Schoolwork is also affected. The behavior, they are seen as people who are just troublesome. And so that also impairs their social life. Okay, and because they are impulsive too, they tend to get into trouble. So you know, the frontal lobe, the part of the brain that is affected is the part of the brain that is responsible for what we say executive function. So that is what will tell you, okay, sit down and focus on this work and complete it. And then also say, no, I shouldn't speak at this time. Even though I feel like speaking, this may not be the right time to speak. So let me just keep quiet now. Or yes, even though I really want this, it's not my turn. So let me wait in line until it's my turn. That is affected in a child with ADHD. So they don't wait for their turn, they get into trouble a lot. So it really affects them, their function. Yes.
Okay. So for the educational setting, say in school, are there any special considerations for such children?
Okay, so yes, this is a child that is easily distracted. So you don't want that child to be sitting close to the windows or at the back of the class or close to children who will distract him. So pinch him, take their pencil, those kind of things. That will further distract that child. So that child usually should be seated close to the teacher or in front of the class where the teacher can keep an eye on that child. And then tasks given to that child should also be broken down. If you give a lot of instructions, that child is likely not to follow through. You know, they have difficulty following through with an instruction to complete it. So just simple instructions, small tasks at a time. When it's completed, then you give another one. And they should be encouraged a lot because it's not easy for them to really complete a task. So reinforce them. When they do well, you encourage them. You let them know that they've done well. And even at home, so such a child should also be a routine, something that is easy to follow. So they know that, okay, I wake up at 6, I brush my teeth at this time, I have my breakfast at this time. So when you make a routine for that child, it's easy for them to follow through. If you just leave things for them, the chances are that nothing will get done. The children should get and helped in their daily lives.
Okay. So does it just involve behavioral management, or do they need to be on some medications as well?
We have to support with medication. Usually, we will start with behavior therapy. So help the child to sit through a task and complete it, and then all that reward systems to just let the child be happy that, okay, I did this, I managed to do this, I got this reward, so let me do it again. But there are times that these children may require medication, and as they grow a little older and their tasks or schoolwork become more complex, they may require medication to help them to focus. There's this chemical in the brain which has also been found to be reduced in children with ADHD. That dopamine is what helps focus. What we give child to stay focused, which should naturally occur in low in children with ADHD. So sometimes they need that medication to help them to focus and do more complex work.
Okay. So we are out of time actually. So I think I'll take your final comments. Maybe we can start from Yesuto.
Okay, so I like to say that ADHD can be very, and so I know parents who go like, oh, it's just one of those things they're trying to say so that I spend money on my child. But I mean, imagine an adulthood where this person is so talented and cannot complete tasks. They don't think through their responses, and then it seems like they're telling lies, but just because they didn't want to focus on giving you the whole story, they just say something to throw you off. And all these things can actually lead to the person, getting, or developing, mental health difficulties, like depression and all others, anxiety, just because, growing up, they didn't have their ADHD addressed. And so I will encourage parents, please don't take ADHD lightly. Work at helping your child overcome this. It's a lifelong condition, but if a person is taught various strategies right from a young age and are very aware of what their strengths and their limitations are, they can take better charge of their own lives and even wear their ADHD like with pride, because there are strengths that they have in there that sometimes we take for granted, like having so much energy to be able to pull off, a task in a certain amount of time. And so let's focus on helping kids with ADHD, especially, become their best selves. Thank you.
Thank you. Osajifo.
Okay. My last word that I will say is when it comes to ADHD, I think parents must pay much attention to their worst interests, because the best way you can work with your child is to find their interests. So we use their interests first so that you can transit them back to interest. Yes. So as a parent, all what you have to do at the Allied Therapist Consult, what we do is we have a shared training for parents that we train them on how to put activities in some sort of discrete trials. I know most parents have issue with brushing of teeth and for the kids to take on in daily activities. So we've been training parents on how to break these activities into a discrete way that a child can copy. We have some kids that works in our clinic that do brush their teeth here in the morning, and with the help of their caretakers or the family, so we teach them how to parent whoever is in concern, so that we can help a ward or your ward who is having an ADHD or the other autism spectrum disorder to become better in the system and to join the mainstream as well.
Okay, thank you. Dr. Mponsa Kodia.
Thank you. What I will say is that parents should take an interest in their child's development. So, some children with ADHD tend to have language delay, speech delay. Okay, so every parent should know the normal development of a child, so that if your child's development is not going the way it should be, you have a child assessed as early as possible. And then my appeal to teachers to be that you look out for these kids. Okay, so when you're in class, you don't just conclude that this child is not intelligent. No, if their grades are low, speak to their parents, let their children get assessed. If they are just so hyperactive, don't just be beating the child. These days they say no beating, but don't be shouting at the child, don't be punishing the child. The child may have ADHD. Speak to the parents and let the child be assessed.